Hey guys, welcome back to my channel. I hope you have enjoyed the business journeys. Every once in a while we'll be back, but this episode we're going to be talking about childhood cancer, and I have Dr. Annet with me. She's going to just share the myths, early detection, and what we need to know as parents. Dr. Annet, welcome to the channel.
Thank you so much.
Please tell my people who you are, what you do.
Okay, I'm a pediatrician. I'm a doctor for children. I generally specialize in cancer for children and blood diseases. And my area of duty is Mlago Hospital, that wonderful hospital.
First, let me ask a bit of a personal question.
Yes.
What got you into pediatric hematology?
Hematology-Oncology. As an intern, generally since childhood I wanted to be a doctor.
Yeah.
Thinking that it's prestigious, all that.
Dr. Annet.
Yeah, Dr. Annet. But it changed along the way because as I came to treat and also learn, it wasn't easy, it wasn't difficult. It changed my perception about being a doctor. You're here to serve and also make others smile as you serve because it makes you happy seeing someone improve.
Yeah.
However, when I was doing my internship, I noted a child with a very huge thing on the cheek going towards the neck. I was wondering, I've never seen such a thing.
Yeah.
And I was told it was cancer. You know what I did? I said, I can't even try. I shook and referred the child to a cancer treatment center for diagnosis, and so it kept raining. I was like, what is this thing?
Yeah.
What is this thing? I want to be in cancer. I want to be in cancer and blood diseases. So when I finished, I quickly did palliative care. I think it would connect me directly.
Yeah.
And had to first go and do my postgraduate, and then joined and did cancer and blood in children, and I enjoyed my time. I feel I'm doing what I love to do. Yes.
That's quite empowering because dealing with children, especially children that have cancer, is...
It takes a passion. If you love something, you'll do it.
How are you able to separate your emotions from the job?
We learn how to do that.
Yeah.
And there's someone I always consult when I'm confused. And I learned how to separate my emotions from patient's care. But at times you're taken up. And we are taken up several times because you can't bear seeing a child
in pain,
seeing a child with very severe symptoms, seeing a child die, and you end up being attached. Imagine you followed up this child for this long and the treatment fails at times, or they came in late. It becomes emotionally draining.
Yeah.
But we have services that care for us. Yeah, there's someone secret I always talk to. I go with my pain and
you look into that person.
And this person has taught me how to care for myself in a working space. Yeah, such a stressful working space.
Yeah, I can imagine. You mentioned that sometimes parents come in late. The child may come in late. What are some signs or things that parents should look out for?
What patients should look out for, it's really important to first know that really cancer exists in children. And when you know cancer exists in children, that's when you can be able to look out for these things.
Yeah.
Yeah, because if you're treating a child, you've gone to Dr. A, you've gone to Dr. B, and the child is not improving, go to a specialist. When you go to the specialist will suspect.
Okay.
And tell you, go to such and such, a doctor in Mlago or whatever hospital they will tell you, and they'll be able to suspect more and send you to
investigate.
Yeah, and investigate and send you to a care center, because not everywhere a child with cancer can be treated. And some investigations are done from a tertiary institution, some can be done somewhere, and as they suspect, they send. That's why we work as a team. So when you're seeing any other doctor, consider seeing a pediatrician. That's when this pediatrician will guide you very well to now us.
Okay. There's someone I know who had a baby recently, and I think at about 7 months, the baby was diagnosed with leukemia. Is there anything that we do or we don't do that causes such things? Because this is a new baby, fresh from the stomach. So what?
My dear, let me tell you one thing. Most of the cancers in children, we don't know the causes. But to some, there are risk factors that can connect and say, this child is at risk of developing cancer, but also that risk can also be low. When you treat a child and you see the child is not improving, that's number one, suspicion. So some of the risk factors, for example, if a child was not vaccinated for hepatitis and the child develops hepatitis B infection, for example, that child is at risk of getting liver cancer.
Okay.
But I can't say the risk is high. As I've told you, 95% of them, we do not know the cause. Something happens and the cells begin producing abnormal, cells become abnormal somehow after changing something there, and they become abnormal, and they begin multiplying at a very fast rate. That's when you begin seeing symptoms, and when the symptoms usually go on, progress faster. Yes, a few cancers, they progress slowly, but most of them they progress faster. Another risk factor can be if a mother, for example, was pregnant with a child and had maybe cancer of the stomach, cancer of the breast, and she receives that radiation therapy as she's pregnant. That child is at high risk of getting some cancers, but how many are those? Very few. Child with HIV or some other disease that compromises immunity can be at risk of getting cancer. For example, a child who had, for example, HIV, they're at risk of getting that Kaposi sarcoma. But how big is that risk? These days, children are well on what?
On treatment.
We have proteins in the body. For example, if signals that tell the body to stop producing cells. So some people may lack that gene that tells the body stop, the control production of those cells. Some may lack that gene. And when they lack that gene, they're at high risk of getting several types of cancers. Some cancers could be familial. For example, some eye cancers are familial. But how many are those? Also very few. Some of them who have, there's a disease called xeroderma pigmentosa. And it's a kind of a disorder that is more of like inherited. So those patients are at risk of getting skin cancers. There's what we call the squamous cell carcinoma. So, but those risks are lower. Like a patient who has received radiation therapy due to something, they're at risk of getting another cancer. Those who have been exposed to chemotherapy, they're at risk of getting another cancer. But those risks are very low. Very low. Like I've told you, 95% of them, we don't know. Something happens there. A mutation occurs and abnormal cells are being produced.
I know there is a mother watching who has the same question I have. Is there anything we can feed our children? Maybe they eat greens, give them green smoothies, detox, that can at least reduce the chances.
The chances. I can't say this or that, but remember, our diets have changed. But I have no evidence to pin it to that.
We live in Africa and we are very intelligent people, so we come up with myths. You're like, so-and-so had it, so-and-so had it, they were living near this and this. Maybe that's what caused the cancer. What are the myths that many of us have believed that you
I agree, we are very intelligent and we think so much. Some people say children do not get cancer. But when you come to Mulago, when you go to the Cancer Institute, when you go to Mbara or Lacho, you will see them. Lacho Hospital, you will see them. And they are not few. The numbers are increasing. So cancer can occur in children. I've even seen a child who was born with cancer. And then others think that cancers in children cannot be cured. We are not in the old age. We can make a diagnosis, we
And
can
treat.
treat, and then follow up till adulthood. So the drugs are there. People have been trained. There are specialists everywhere. Not everywhere. There are people who have been trained in making a diagnosis, like me, and also managing the child with cancer. The child becomes cancer-free.
Yeah.
Though at times you can treat and it comes back. It's not my fault that the cancer that you've tried to treat that has come back. But some cancers, when you look at their biology, they're quite aggressive. And also depends on at what stage has the child, have they come early or have they come when the disease is too bad, it has spread, when chances of survival are minimal. At times we go left, right, center, but when we go all that side, we should think twice and also come to the specialist. Others believe that cancer is contagious.
It's not.
We can't eat on the
Touch
same.
someone's swelling and then you also get
Yes,
it.
and I will not eat on the same plate with you. I can eat on the same plate with you if you have cancer, and I will not get the disease.
Yeah.
You understand? So some of them stigmatize them. Others say it's witchcraft. You're bewitched. You're cursed. We don't believe that. Yeah, something happens.
Yeah.
Yeah, and cells are produced abnormally. Others say that when you do surgery for these children, you're just spreading the cancer. For example, a child can come with a very huge stomach like this, and the tumor, we call it tumor, the mass is big inside there. You have to first give treatment to shrink it. When it has shrunk, the pediatric surgeons come in and remove the whole thing carefully without spreading it. And then after we test it, and then we give also treatment. So all that depends. So surgery does not necessarily spread, but we are cautious. That's why when it comes at the point of doing surgery, surgeons first see the patient and say, okay, this one is fit for surgery. This one is not fit for surgery. First do ABCD and we work as a team.
Yeah.
We try to understand each other and get reasons and suggest ways of doing things, which is the best way of handling a patient, because the patient is always at the center and we work at the best interest of the patient. Yeah.
For me, I'm amazed that in Uganda, we're actually able to treat cancer to this level. We're always seeing posters, someone needs to fly out, but it's important that we know that these services are also available here.
Yeah.
Treating cancer takes a while.
Yeah.
I attended a meeting a week ago, and we learned that it can take 2 to even 3 years and even more. How do you, as a doctor, support a parent who is looking after their sick child, but they also have other children?
I think it's a two-sided thing. We have to do our part, but
you also seek help and be persistent while seeking for it.
It's too dangerous when they start treatment and then they stop on the way or they don't come as appointed. Chances of cure are also lower. So, which makes life hard for us, for the patient and the family, because when it comes back, it's harder to manage. And these drugs are expensive, and remember, we are endeavoring to ensure they don't pay for them. Because by the time they come to us, they have gone to Dr. A, they have gone to a traditional person, some have sold everything. And now they come, they will need financial support, they will not have food, they will not. You encourage them. Some of them end up thinking and begin having income generating activities. Some of them also, let's strategize, daddy be here or get. There's a way families, some families wonderfully plan for how the child will be cared for. And those who are from far, we have hostels. Because you may be coming from Kapchora and yet you have to get treatment on Monday, Wednesday, Friday. You will not go back to Kapchora. Accommodation in Kampala is tough. So there are people who are also giving us a hand, giving us a place to stay, like place the child, Kawempe home care. They feed the children and one caretaker. When it's time to come to hospital, they bring them. In case of an emergency, they bring them. Generally, people are out there and helping and assisting. But if we work by ourselves just like this, it's heavy. But we are doing our best, and we shall continue doing our best. Things are not the way they were. Things are getting better, and they're yet to get better.
Yeah. Okay. Now, this one, I'm just appealing to you. As a mom and a doctor, what are some things that you would advise parents to not feed their children?
Oh my God, that has been a trouble. First of all, if you spend time with your child, you'll get time to ensure they also feed well.
Yeah.
And when children are growing up, they need a balanced diet. And these are things we've been taught. Food from
organic food.
Organic foods. For example, the potatoes, the rice, not these processed foods. Those come in as snacks, but not
once
food.
in a while.
Yes, not food. If a child has done something good, that's a reward. But it shouldn't replace the value of the proteins we get from food, the carbohydrates, the oils, the vitamins. And these foods can help the children be intelligent and brilliant, but while spoil them with what they want. These children should not rule us as parents. We are there because that's why we are parents. We have to guide them.
Parent them.
Yes, and guide them. Why should the child have a tantrum because I want only gorillas, I want only KFC, I only want whatever, Cafe Javas only. Even if you go to Cafe Javas, there's food they can give, good food, instead of just snacking and snacking.
Overprocessed.
Yes, overprocessed. So, and how good it is to prepare food for your own child and relate with your own child as you watch your child grow up despite the busy schedule.
Yeah.
What's the use of getting too much money and I lose my own child? Yes.
Dr. Annet, is there a case that you have handled that has stayed so close to your heart?
Several. Several. Some have made me shed tears. Others we are rejoicing. Others the story started badly and it's good. Yes, several.
What can we as a community, because you guys are doing a lot, and thank you for mentioning those homes that are actually supporting families that are going through this, what can we as a community do to support the families that are going through it so that their load is?
We need those support groups for the parents, for the teenagers, but we need to also support parents with activities that can generate income and also help them emotionally. Let them not feel I'm alone in this, because I've experienced families breaking. Another thing we need is awareness. Let the world know, let people know that cancer is there for children and it can be cured.
Yeah.
The challenge is, at what point have they come? And at times you watch a child, they have just come in with a huge mass, it's blocking where they are breathing from. You try to leave the child in one position, she doesn't know why you want to leave them in that position. And then the father doesn't understand, like, please, or the caretaker, this is why I don't want the child to be in this position. The caretaker moves a bit there, the child changes. You come back and find the child dead. The child could have had a chance. And some people even neglect children at the hospital.
Yeah.
Because when you tell them about the diagnosis, you run and leave the child.
Maybe they're scared of costs.
Yeah, but you know Mlago Hospital, whatever we can give, the hospital gives. Whatever it can't give, they ask
you to.
Yeah, but usually cancer care services, make sure
you meet at least
whatever need to try. But we can't meet 100%. At least the cost of the drugs, the radiotherapy, the scans, the surgery, you don't go through all that hassle.
Yeah.
But of course, you participate in the care. We need people to be involved. The students need to be made happy. We need people to come around, encourage, elevate their mood, let them forget about even if they're in the hospital. We need a lot.
So what we do is just come to the Cancer Institute and say, I want to volunteer.
Like
or
me,
there's a process.
There's a process. For example, I'm in Mlago.
Yes.
And we have a cancer center in Mlago. Also, Cancer Institute has a wonderful center. Mlago has a wonderful center. Like now, if you come to me, I'll take you through the correct channel so that you get permission. You don't just come to my house and just...
I'm here to give you food.
Yes. There are channels we all go through. We all humble ourselves. Like if I come to your office, I have to come as a human being, humble myself down, introduce myself, tell you why I'm here, and you guide me on the right way how to go through the process and how I can be of help. Yes, and that's a good relationship. Yeah. Okay.
I think I'll be sharing some emails and some contacts for people who want to support the cause, and there's some organizations that have come up and already have permission and are supporting the families. Yeah. I want you to look into the camera and talk to a parent who has just found out that their child has cancer, or even a caretaker who is already on that journey, and just encourage them as a doctor.
I'm encouraging you not to lose heart. Please, this is a time for you to fight for your child. Fight for that little one. That little one is fighting hard, and their faith is on you. Please don't give up. We are also here. Approach anyone you feel like this is the person I'm comfortable with. Me, approach me, and I don't become approachable for you, but there is doctor so and so, there is nurse so and so, there is this counselor. Please do it. So that we all work together and relate with us. We are not. We want also to be the best. We want to keep on improving. Give us feedback and help us be better. Thank you.
Wow. Thank you, Dr. Annet. I think this has been very insightful for me and for many parents. And I pray that this starts a conversation that brings change and even improves the care that is currently provided. So thank you for coming to the channel.
Thank you.
And it has also improved our parenting. People who have been rushing for snacks, I hope this was a light bulb moment for you. Thank you for coming to the channel. Guys, thanks for watching. I will see you next Friday. And remember, I am rooting for you.